This is the February 9th, 2021 Lane County Board of Commissioners meeting. Before we review the agenda, I will remind commissioners we have an 11 a.m. time certain executive committee meeting. At this time, are there any adjustments to our agenda? Commissioner Bozovich, I couldn't tell. Did I see your hand raised? Yeah. Please.
Yeah. Yes, I just wanted to make sure that we're pulling item 6D1 from the consent agenda for separate discussion and vote.
Yes, as I believe I shared with you, sir, I forwarded that to Diana and she did, in fact, make that change.
Thank you.
And Chair Bernie, before I make the motion for the consent calendar later in the agenda, I will have a short announcement also prior to the passage of it.
Okay, is there any emergency business we need to tend to?
We don't have any emergency business, Mr. Chair. I would, if you don't mind, I'd make a brief statement about our website, which has been a topic of discussion in the community. Is that okay to do that now?
Yes, because up until this moment, that has been emergency business for all of us. Please do.
Yeah, it has. So really pleased to let the board and the public know that our main site was restored at 3 a.m. this morning. I want to just give a little bit of background on this so everyone understands what happened. In the early afternoon on Thursday, February 4th, Lane County's website began experiencing intermittent outages after 1 p.m. and the timing of those issues correlated with the timing of Lane County's launch of our new vaccine pre-registration form that was really popular and got thousands of people to sign up for. And so it led to some initial beliefs that the higher traffic volume may be causing those troubles. By later in that afternoon, about 4 p.m. on Thursday afternoon, Lane County's website hosting provider Civic Live. So our website is hosted by a private hosting provider called Civic Live. They informed Lane County that they were having a widespread outage of services to hundreds of their customer sites worldwide. So it was really a widespread issue beyond just Lane County. Friday morning, our technology staff, in partnership with Devin Ashbridge, our public information officer, stood up a temporary website to provide links to many services, forms, critical information, and redirected traffic to that. I just want to highlight that point that we, Mike Finch, our chief information officer, monitored other sites that are hosted by Civic Live. None of them were standing up separate sites to make available. So it's sort of a unique thing that we did here in Lane County to make sure that the public and our officials have access to information, even though the core site was down. So really great and quick work, just in a matter of less than a day to get that temporary site. We call that disaster recovery, right? Where there's a backup plan when the primary issue is experiencing trouble. So staff then monitored the situation over the weekend and through Monday, continuing to add content to the temporary site as needed, including all materials and links for today's board meetings. Civic Live notified Lane County that service to our main site was restored at 3 a.m. this morning. And staff are in the process of redirecting traffic back to our main site at this time. So we should be close to fully operational there. We'll just add a little caveat that the site may be a little choppy. I know Commissioner Farr this morning at our agenda team meeting was a little bit choppy getting on the site, and that may remain for a little bit. I want to just call out a few folks: Brad Welch, Craig Leeper, Maurice Gwen, Josh Loftus, and Jim Garner from Technology Services, and Devin Ashbridge, our public information officer, who all worked really all hours of the night and through the weekend, standing up the temporary website, redirecting worldwide traffic to while our website service provider was down. They helped maintain access to services and critical information, including phone numbers and board materials during the outage. And again, they responded at all hours at night and on the weekend. Those individuals and several others, and Mike Finch deserves a lot of credit too for coordinating all of this, really demonstrated again those three core behaviors that we lift up and identify in our employees when they're at their best: a passion to serve, a drive to connect, and a focus on solutions. So want to thank that great team for their great work, and we're pleased that it's back up and running, and thanks to everyone for their patience with that outage.
Thank you very much, Steve. I hope the board doesn't mind, but we discussed and requested Steve call that out because we could not do our business without this kind of support. And to Mike Finch and Diana and everyone, thank you so much for allowing our work to continue. We are now at the public comment part of our meetings. To the public watching, you are currently registered in this meeting system as attendees. You are participants who are audience members viewing. Your microphone and webcam are automatically muted as attendees. It is now time for public comment. At this time, if you wish to participate in public comment, we will ask you to raise your virtual hand, be recognized. You should see the hand icon on the device you are using to watch the meeting. Press the hand icon only once to raise your hand. When public comment begins, our meeting Diana, will call names. When your name is called, you'll be unmuted, given 3 minutes to make your public comment. When your 3 minutes are up, you'll be returned to muted status, and the next name will be called. You can then continue to watch the webinar as long as you choose. The intent here is obviously that everyone wishing to make public comments has that opportunity. If there are more people wishing to make public comments than time allowed, we may need to either limit the number of speakers or the time for public comments. That rarely occurs. Speakers will then be selected randomly. So, Diana, at this time, is anyone seeking to make public comments to the board?
Thank you, Chair Bernie. Yes, at this time I do see 2 hands raised. I do see more attendees have logged on. So if you would like to give public comment, now would be the time to raise your virtual hand. At this time, I will call on Deborah McGee to give public comment. That will be followed by Jim New. Deborah, I will unmute you and begin the timer, and you may begin your public comment. Thank you. Deborah, I do show yourself muted. There you go.
How's that? Excellent. Good morning. My name is Deborah McGee, and Heather Buck is my commissioner. I am a retired public school and university instructor in counseling and education. Last week, finally, for the first time, I took our electric vehicle and drove up the McKenzie to see the consequences of the wildfire. I felt devastated, sad, and I felt fearful for my safety where I live in the woods in my home south of Eugene. And then I began to think about the new realities that I'm learning about fire. Fire is good for forests. Indigenous peoples used fire to keep the land healthy. As we continued up to McKenzie, I began to see what wasn't healthy for the forest. Logging operation after logging operation, trucks and loaders, hillside after hillside, clear cut, mountains scraped from top to bottom, dragging trees. I've been learning that tree plantation forestry practices increase fire risk and endanger the state and federal forests that belong to the people. Salvage logging? Burned trees are not discarded material to be salvaged. The value of a burned forest is important. It provides vital habitat for wildlife. It provides ecological services. Ecological services? Those are the very things we depend on for our survival. Clean air and clean water. Burned forests also sequester carbon. Charcoal stores carbon for centuries. I realize that you folks do not have control of forestry practices that affect every one of us in Lane County, but I'm asking of you 2 things. First, that you use your influence to educate the public about the truth about wildfires. And second, that you use your power of influence, the power of the people who elected you to be officials in Lane County, to communicate and influence with state representatives who do have the power to change the rules around forestry. We've learned that the Pacific Northwest forests are as important as the Amazon forest at sequestering carbon from the atmosphere. We've learned that the timber industry is the biggest cause of greenhouse gas emissions in Oregon, while only being 3% of Oregon's economy. They hold us all hostage in being able to reach our climate goals. In Oregon, in Lane County, forests are our biggest climate solution. People are waking up to the climate emergency and need fair timber taxes to help us transition. For the sake of our children and all living things, please lead the people to end the destruction of our best hope for a livable future. Forest defense is truly climate defense. Please be climate heroes. Thank you.
Thank you for your public comment. I will reset the timer and I will call on Jim New. Mr. New, I will unmute you and you may begin your public comment. Mr. New, I do show you are self-muted. You should, I see you're ready to go now, Mr. New. Mr. New, we cannot hear you. I do show you've unmuted, but we can't hear you. I will pause on Mr. New. Mr. New, I'm going to unmute you for a moment. I do see two other people have signed up for public comment or are attending, but they have not raised their hand for public comment. If you would like me to call upon you, please raise your virtual hand and I will call upon you. I do not see any other hands going up. I'm going to return to Mr. New and see if we can get audio on him. Hold on one moment. Mr. New, I'm unmuting you. I do show you are self-muted again. Mr. New, you are still self-muted. If you want to try one more time to unmute. There you go. I've shown you've unmuted. I'm not hearing you speak at this time yet. Can you?
That's too bad.
Yeah, Mr. New, I apologize. We are unable to hear you at this time. If you would like to submit your testimony in written format, I will make sure the commissioners get it and that it is attached to the public comment section of our agenda for this day. At this time, Chair Burney, I do not see anyone else wishing to give public comment, so I will turn the meeting back over to you.
Okay, well, we're all very sorry, Mr. New, we couldn't hear your comments. At this time, is there any commissioner that wants to either respond to the one comment we were able to receive or other issues or remonstrances? Commissioners? Vice Chair Farr.
Thank you, Chair Burney. This, I think, is a good time to just make a quick couple of comments regarding our winter strategies efforts and our ongoing efforts on both transitional and permanent housing. You all know that last week we opened MLK Commons, or we opened the front doors, and placement will begin this week regarding people moving into the 51 fully supported apartments that we have opened at MLK Commons adjacent to LC Behavioral Health. A lot of work went into that. Needless to say, everybody in this room, everybody in this meeting had some part in it. But I really want to call out one person in particular. And I'm only going to call out one person, that is Steve Manella. Steve Manella is the person whose original thoughts were the genesis of this project. And it happened a number of years ago that Steve was, he was talking about supportive housing and what it meant, and that we really had a dearth of supportive housing. It is in the strategic plan and one of the goals of the Poverty and Homelessness Board to add permanent supportive housing. And as you know, Mr. Chair, MLK Commons is a flagship for us. It's 51 units that are beautifully appointed and will provide immediate relief, provide saving lives and easing suffering for at least 51 people immediately, and then for generations to come. So good work to everybody who put strong effort into that, particularly Steve Manella, who once again, his original thoughts were the genesis of that particular project, and a lot of work went into it, a lot of boots on the ground to make it happen. The second thing I want to call out is emergency and potential transitional housing that's happening with our pallet shelters. You know, we've distributed 120 pallet shelters throughout the county at this point in time, and we're developing a body of evidence showing how effective they are at, once again, saving lives and easing suffering of people who otherwise would be living potentially in tents or in worse living situations. Just a quick rundown right now, Cottage Grove has 18 structures, 21 have been sent to Florence, Bonita has 6, 3 to Oak Ridge. That's the rural presence of the pallet shelters. In Eugene, we have 6 deployed at Roosevelt and 6 at the First Baptist Church, which will be open on Friday for youth. Hosea Youth Services will be placing youth at First Baptist Church, and Lane County helped prep that site with electricity and getting it ready for those 6 shelters. The First Congregational Church has 3, First Baptist Church has 6. The Eugene Mission has a dozen of the shelters are in place that are providing immediate support. St. Vincent de Paul's Annex has 6, and in Springfield we have 5 at South 42nd, and Carriot Ford at the county site on Highway 99 has 2. Significantly, our largest distribution is to St. Vincent de Paul's Dusk to Dawn program. 25 units have been deployed to Dusk to Dawn, and the site preparation is underway for that. But Lane County has provided 25 units to Dusk to Dawn. That if you do the tally on that, that's 121. I don't know where the extra 1 came from, but currently we are once again developing a body of evidence to demonstrate the suffering eased and lives saved by these pallet shelters. It's pretty remarkable. Everybody who sees them, and we had a chance to talk about them extensively yesterday at AOC, at both our health committee meeting and then last week at the veterans meeting. Everybody is impressed, and everybody is watching for the evidence regarding the use of the shelters. Ms. Mokrahysky, please pass along thanks from me personally and from everybody who's associated with the distribution of the pallet shelters. Catherine Ryan, who many of you have met, Catherine is doing much of the outreach work regarding the pallet shelters. One last thing I will say is regarding congregate unsanctioned housing. We have a number of sites throughout the metropolitan area and beyond where people are congregating in tents, etc. We do have a general rule that we are not dispersing congregate camps until there are places for people to be moved to. There are a couple of reasons for that. One is that the CDC has recommended we don't disperse congregate camps based on the potential spread of COVID-19. And additionally, we still have a requirement that we adhere to underneath the Ninth Circuit Court decision regarding people camping on public land. So we're working hard, staff is working hard to find places to move people who are currently in unsanctioned congregate camps. A lot of work is going into that. Mr. Mokrahysky, thank you very much for that work. Mr. Chair, sorry I took a little bit longer than I anticipated, but there's a lot to talk about regarding our winter strategies and how we're taking care of people who are living on the streets. Thank you.
Well, I should not have to say this to you, Commissioner, but never apologize for being enthused about ending and mitigating suffering. Is there any other commissioner that would like to make a statement? Commissioner Bozievich.
Thank you. I want to spend a little time and talk about COVID-19. First, I just want to really give our staff a lot of thanks and kudos for the hard work they're doing and the amazing job our IT folks did with the website. Once I was notified we had the temporary site up, Elizabeth and I were able to get on and register in the vaccine registration form, and it took less than 2 minutes to register. And the link worked right right away. And several of her employees did it at the same time. I would recommend everybody get on and register for vaccination and notifications. It's probably the best and easiest way rather than trying to get through a call center or some other method of notification. But I want to just express my frustration at how the entire pandemic's being handled at the state level and how it is impacting our ability to handle it at the county level. From the testing, where U of O students and football players are being tested on a regular basis, yet we only are requiring nursing home employees to be tested once a month. I mean, football players get tested at least once a week. And I know of U of O students that have been tested multiple times more than nursing home employees that are working with our most vulnerable population. When we talk about restrictions on business, they shut down gymnasiums that have no record of transmission of COVID cases to the public. Yet we left the U of O open, who was responsible for 259 cases over the last 14 days, which is 33% of the total cases in Lane County over the last 2 weeks. But for the U of O, we would be down a risk level. And then when it comes to vaccines, seniors 85 plus have a 1 in 5 chance of dying if they get COVID-19. People between the ages of 30 and 40 have a 1 in 1,000 chance. But our state put 30-year-old teachers ahead of 85-year-old seniors in the vaccine distribution list. Let alone finishing up the phase 1A medical providers before they started adding people to the vaccine eligible list. But it's the counties that get the phone calls about when am I going to get my vaccine. It's the counties that get the phone calls about our business still being shut down. Something has got to change in how we are managing COVID in this state. And it's got to be managed by data and science, not by politics.
Commissioner Bozievich, are you through? Okay, thank you, sir. Is there any other commissioner that would like to respond or make a statement? Commissioner Trieger.
Thank you. Good morning, Chair. Thank you so much.
Good morning.
I also just want to appreciate the staff. I can attest that folks were working all weekend and round the clock on the website issue based on some text conversations I was having back and forth, and I really appreciate everyone working so hard to keep information accessible to the public. I want to thank Ms. McGee for her testimony and appreciate the time that she's taken in our community to work on this critical issue of climate. I know she's just spent countless hours educating herself and helping bring others along on this critical issue. I also want to thank Commissioner Farr for his comments and sharing more details with the public about the deployment of the pallet shelters and the commons and other permanent supportive housing initiatives that we're working on. And I will have a little more comment on that topic specifically later in our future board assignment requests. I do want to specifically also respond to Commissioner Bozievich's comments about our response to COVID testing and vaccines. Everyone is frustrated, rightly so, all over the country. We are not doing a good enough job, but we are doing an exceptional job relative to many other states and to some other counties in Oregon. And I think it's important that we stay focused on what we're doing right and do more of that and be solution oriented. I think regarding specifically the U of O population, you know, that bell has rung. That campus, that community, the people who are connected with it, including students, are part of our community. They're also employees in some of our local businesses. They're certainly patrons of our local businesses. They live here. Many of the students who live off campus, which is a much higher rate of infection than on-campus students, are here because they are in year-long leases that cannot be broken. So I think it's really important that we just recognize the university community as part of Lane County. And the notion, as was made at last week's meeting specifically, that we should not include those numbers in our case counts is disingenuous. It's unscientific. It changes nothing about the rate of infection in our community to simply hide those numbers. And it's not, frankly, as the Board of Health, it's dangerous to suggest such a thing, let alone to actually do it. So I recognize the frustrations. I'm also receiving the calls. And I just want to specifically say that the university community, while unique, and maybe we could be doing more to work with them on how to approach their case rates and the resources that they're receiving for testing that's not available to the general public. I also want to acknowledge and call out that they've been a critically important partner in standing up our vaccine clinics. I had the honor of touring and then volunteering for a little bit of time over the weekend for a few hours, working alongside staff and meeting some of the folks from the U of O who were integral to the success of those clinics and helping us get vaccine out to the community. Thank you.
Thank you, Commissioner. Before we start a potential second round, does any other commissioner want to make any other statement? What a surprise. Yes, Commissioner Buck.
I just wanted to thank Ms. McGee for speaking, and we have the Holiday Farm Fire up next on our agenda, so I was actually going to speak to some of that at on our next agenda item.
Thank you, Commissioner. I see that Commissioner Bozovich has his hand up also. Commissioner?
Thank you. I just want to correct a couple things that Commissioner Traeger stated. In the last week, there have been 69 on-campus cases of COVID and 54 off-campus in students. So on-campus is actually leading right now in COVID cases. And I also want to note that they are only 6.6% of our total population in this county, concentrated in a few square miles of the county of over 4,000 square miles, and responsible for 33% of the cases in the last 2 weeks. Considering allowing areas like Junction City, Florence, Oak Ridge, and Cottage Grove to lift some of their restrictions when we have a concentrated source in a very concentrated area of county is scientific. It's not unscientific to maybe consider lifting some of those restrictions and maybe keeping or even increasing restrictions in the university area. So I just want to make sure we're dealing with facts. Like I said, let's do it with facts and science. And the fact is we're seeing basically an equal amount of on-campus as off-campus. And in fact, recently it's actually tilted to on-campus cases.
Would any other commissioner like to make a statement? Okay. I would just like to express to Ms. McGee, thank you for your comment. And to Jim, I'm really sorry we couldn't hear from you. This is our life remotely at this point in time. I have no further discussion on these items. Item 5 now, County Administration. 5A, Monthly Holiday Farm Fire Update. Mr. Mokrahysky, Mr. Hurley, Mr. McCray. Steve, would you like to start this discussion?
Well, I'm not sure if Mr. Hurley is, we're going to just pass it off to Matt McCray, and we're really excited to have Matt on board. And for those of you who've been participating in various meetings around the Holiday Farm Fire, Mackenzie River Valley recovery work, Matt's has jumped in with both feet and is doing a great job of coordinating and being present in the community. So we'll turn it over. Dan, if you have comments, great. Otherwise, we'll go right to Matt.
Great. Good morning, Commissioners. Yes, very excited to introduce Matt to you today, and I'll let Matt introduce himself to you. He's been with us for a full 2 weeks now, learning a lot. He made it up to the resource fair that was community-led up in Upper McKenzie, and got to meet some of the wildfire survivors and try to connect people to services. Doing a great job in his first couple weeks, but really, trying to get up to speed with what we've been working on for the last 5 months on this recovery effort. So I'll pass to Matt, and he can introduce himself to you and provide some updates. And then I would like to share one note about the catering effort that you might not know about, just to highlight one positive thing that's happening on this recovery effort. So Matt.
Great, thanks very much. Can you all hear me okay? Is audio?
Yes.
All right, great, thank you. Thanks, Chair Bernie, Commissioners. It's great to be before you. I'm excited to be working for Lane County. Thank you so much for the opportunity to jump in and work in this role. My name is Matt McCray. I'm the Disaster Recovery Manager for Lane County. I have the privilege of being focused on a relatively small area of just the Holiday Farm fire, which really, I think, is going to enable to be more effective at supporting the recovery. So I'm grateful to have a relatively small area to focus on. I started just a couple weeks ago and getting my feet on the ground, as Dan mentioned. Very brief background about myself. I spent 8 years working in the city manager's office for the city of Eugene, and 3 years working in emergency management as part of that, where I worked on hazard mitigation primarily. So I oversaw the implementation of a Eugene Springfield Natural Hazards Vulnerability Assessment, and I was a project manager for the update of the Eugene Springfield Natural Hazards Mitigation Plan. There may be other things relevant, but I just want to be brief today, so that's enough about me. In terms of the wildfire recovery efforts, I'm not going to touch on everything that's in the brief that was provided to you yesterday. I just want to hit a couple of what I perceive to be the most important issues to focus on, and that's sheltering, housing, and hazard trees. As of February 4th, there were 167 wildfire survivors still sheltered in 11 hotels in Lane County. And I think this is something for us collectively it's easy for us to collectively lose sight of. The fact that we have a number of people who are displaced, who are living in suboptimal conditions. They're safe, they're sheltered, but this is nobody wants to live in a hotel for a long duration. And it's absolutely our highest priority to help move those people into longer term, more stable housing situation. On the note of housing, we're really fortunate in terms of the timing that there are a number of housing opportunities that are coming open right now. One, I know Commissioner Buck and other staff prior to me worked really hard to make sure that FEMA opened up a direct housing emission, which is a project upstream in the Blue River area or in the affected area to try and house people up there. There are staff on the ground right now, FEMA staff on the ground right now, looking for a suitable location or potentially a few locations because we don't know which ones will pan out. And we are working in close coordination with them to try and find suitable locations. I also mentioned in the brief here that there are 2 projects that have been opened or are opening soon with Homes for Good, which is fantastic timing in terms of wildfire survivors. And those homes were needed for low-income housing in the first place. So it's fortuitous for those who have been displaced by the fires, but of course you all know that the need for sheltering unhoused in this community is large and remains large. And lastly, I just want to touch on hazard trees because you likely heard about the hazard tree effort upriver. ODOT has a remarkable charge to keep the Highway 126 corridor open, and they have hired contractors to mark and remove hazard trees on both sides of the highway for the entire 25-mile stretch that was affected by the fire. That is a huge undertaking and is going to affect traffic moving up and down 126 for the coming months. It's something for us to bear in mind is that 126 is going to be inhibited for a significant period of time. You also may have heard about that ODOT contractors, the hazard tree assessors, were over marking hazard trees, and they were marking trees outside of the area that could potentially influence or affect the highway itself, and they were marking trees that were questionably hazardous. So ODOT has now gone back to reassess those trees, and they've narrowed up the trees that they're considering hazardous, which is really great to see their responsiveness there. Anyway, they over the next several months are going to continue with the hazard tree removal along 126. My understanding is that Lane County roads are largely served already in terms of removal of primary hazard trees. So our roads are serviceable, and that work has really largely been done. That's all I want to provide for you, and Wayne, in a way of a proactive brief here for you, but I'm of course here if you have questions. And I know Dan has an update on the feeding as well. So I'll stop there. Thank you all.
All right, why don't we go ahead and take questions from the board. And Diane, if you're hearing, if you can make me a presenter, I do have one slide I'd like to share. Does the board have any questions?
Commissioners, do any of you have any questions or items you would like to discuss at this time? Commissioner Buck.
I don't have any questions, but just things to share. Matt and I spent a couple days up the McKinsey on Friday and Saturday at the Locals for Locals resource fair in their 2 gyms, and got to see a number of people that I've been talking with, helping get through various challenging items in rebuilding up there. There wasn't quite as many people as we thought we'd be able to see, but it is still in the early stages of the rebuilding and recovery process. But the group Locals for Locals did an excellent job of getting a variety of different agencies, builders, architects, plumbers, and we had several county folks up there to represent our needs. So I just want to thank them publicly for doing that. And it was very nice to get to know our new resource and recovery manager, Matt, more during that process. So thank you for being there, Matt. And I know you got to meet a lot of the locals there, and I know that they appreciate that.
Thank you, Commissioner.
Are there other commissioners? Commissioner Trieger.
Thank you, Chair. Welcome, Mr. McCray. It's great to see you and have you here at the county. Looking forward to all the excellent work I know you're going to do. I have a quick question, and I appreciated your comments about recognizing both the urgency for displaced folks to be housed, but also because our resources and housing units are so scarce that by definition, housing them in particularly a Homes for Good project means someone else has to wait that much longer for their home. I appreciate the sensitivity to that. I have a 2-part question. One is, do we have any kind of sense the folks in those 60 units specifically? I'm sure it's a mix of answers because every household has unique needs and situation, but how long we anticipate them being in those units? The other question on the sheltering and housing side is I see you're working to identify places for folks with self-contained units, RVs and so on. And is that need exclusive to folks staying in the community, or might other sites that are ready for self-contained units and available be useful elsewhere in the county? Thank you.
Yeah, good questions. The first one, in terms of how long we expect people to remain in hotels, it's hard to speculate, but I would expect at least another month before, and probably longer than that, but at least another month before those folks are moved into other housing. It's a slow process to get people transitioned into more stable housing, unfortunately. And many of the people who had means to relocate on their own have already done that. So, this is a population that is less able to, less resourced to support their own efforts to find long-term housing. Your other question about like RVs, recreational vehicles, or mobile homes. So FEMA is actively looking for sites, not so much in town. They're really looking upriver specifically for locations where people can either park an RV if they have one of their own, or where FEMA can provide an RV or a mobile home on site for sheltering. I will note that Lane County is already allowing people who have their own RVs to temporarily locate on their properties as they're going through the rebuilding process. And Lane County has waived the fees. You may know this. Waived the fees for permits for that temporary placement of those recreational vehicles for temporary housing. And that is certainly happening quite a bit. We're seeing a lot of people who have that kind of vehicle moving up on their own. I'm not sure if that answers all of your questions, but go ahead.
Yeah, just thank you for that. It mostly does. You mentioned the folks in hotels, but I was asking specifically about the Homes for Good units in Springfield and Bethel. And part of what I'm hearing you say is that the folks that are being housed there, while they may not meet the criteria, income, and so on, other folks from the general community might have, certainly as a result of these fires, they do or are closer to that. So in other words, I want the community to be sure they know that we're not using Homes for Good units for folks who would otherwise have resources to find housing in another way. Is that accurate? And that was the population I was asking if we had any sense of duration for them using that housing resource. Thank you.
That is an accurate statement, that we are not providing homes for people who otherwise would be able to provide homes for themselves. These are certainly people with an immediate and need, for sure. And in terms of getting people into the housing that Homes for Good is providing, they're registering right now. In fact, we have a few state staff who are going to come on and support the registration process for the people who have been displaced by fires to help make that process move quicker. I would expect it will be on the order of a month or so before people who are registering are actually moving into those properties for Homes for Good. On that order, it's not 30 days, but it's less than 3 months.
Thank you, Commissioner. Thank you, Mr. McCray. Are there other commissioners? Seeing none. Dan, I know you wanted to review another item with us. Can't hear you, Dan.
I did. I wanted to highlight a local business here. Hopefully you can see this slide. Are you seeing that? The pictures? Yes. Great. So I wanted to highlight this local business that's doing a terrific job helping our wildfire survivors. Early in the disaster recovery, the Oregon Department of Human Services contracted with local caterers to provide the meals in the hotels. And I've been hearing great things about our local caterer who's working on this project. And their name is Cravings Fine Foods, and they're owned by Colleen Brainerd and her husband. And they've owned this catering business for 28 years. And with COVID, their business would have been devastated, but they were able to take on this great work. And I hear that they've just done a terrific job providing nice meals for folks. They try to mix it up. They try to add special things during the holidays. They partnered with Lonnie Moku Grill and provided gift certificates into some of the gift bags at the holidays. Just doing a lot of great things and a friendly staff, and just wanted to highlight their great work. There are a lot of elements to this whole recovery, and this is just one bright spot. And just wanted to provide them a special thanks for the work they're doing. Earlier on, they were providing to over 600 people. Now it's down to about 180 people, but they're providing 3 meals a day at several hotels and really sustaining people through these challenging times. And that's all I had to share. Thanks.
Thank you, Dan. In that I haven't spoken, is there any other commissioner who would like to make a statement or ask a question? In that I haven't spoken, when you mentioned Cravings, I'm going to date myself. 28 years ago, when Cravings opened around 16th and Willamette, if memory serves, that was the favorite haunt for this young lady named Betsy Boyd that worked for a relatively new congressman named Peter DeFazio. And Betsy took me by the hand and was orienting me to a variety of things. So it's really sort of one of those full circle things, and it's very wonderful to hear the good work Cravings is doing. I just like their food. So thank you, Cravings. Thank you, Mr. McCray. Thank you, Mr. Hurley. We are now.
Thanks very much.
Thank you. We are now moving to item 5, County Administration. B, an item that is so on commissioners' minds that they couldn't stop talking about it before we even reached this item, but now will be another opportunity to do that. COVID-19 response and recovery. Mr. Mokrahajski and Mr. Adams.
Thank you, Chair and Commissioners. We know this is a topic, of course, that remains at the front of your minds and your concerns. I'll just make a few introductory comments, and then Mr. Adams will dive into some more of the details. I want to just note, particularly around vaccinations, we continue to make really strong progress in while it is slow, and we wish there was a greater supply of vaccine to our state and to our local community. We are seeing those numbers tick up. We have about 10% of our population has now has received at least one vaccine. Over 10,000 residents in Lane County are now fully vaccinated, and over 20,000 residents have received their first dose of vaccine. Great work continues to happen in getting the doses out that we receive. We are working really hard to make sure that every dose gets in an arm of our residents. We're working very hard to make sure that we are following the state rules around sequencing the distribution and following the priority groups that the governor and the Oregon Health Authority have defined. Just last week alone, we administered around 6,000 doses of COVID-19 vaccine from Lane County, with additional vaccine from our healthcare partners. And over 4,000 of those vaccines happened over a couple days at 2 different locations, Saturday and Sunday. On Saturday, around 1,500 doses of Moderna for 1A population folks, around 1,000 doses on Sunday of Pfizer for second doses of folks that had received 3 weeks ago our first vaccines from our first mass vaccination clinic. And then we also had a few days where we administered 2,000 doses to 1B Group 1 individuals. So folks, particularly in the early learning and childcare arenas. The K-12, 1,600 doses went to K-12. So really great progress continues to happen there. We're moving through that K-12 population. We've moved through now the majority of the 1A population, and a good chunk, probably about 1/3 of our K-12 early learning and childcare have now received their first vaccine after just a couple weeks of being eligible. This week, Mr. Adams will talk a little bit more detail about this week as 80+ age individuals became eligible yesterday. We're working really hard to administer 2,000 doses that we received for that population, that phase 1 group 2 population, through Lane County. And then we're also working with Peace Health that has 3,500 doses of Pfizer, and working on a portion of those being distributed through Peace Health's clinics out in rural communities on the coast and in rural communities. And then Lane County standing up some mass vaccination clinics for 80+ individuals as well. So we're really working to make sure that as each group becomes eligible, that week they become eligible. We're working hard to find vaccine that we can get to that population at the same time that we're still working through the priority groups that have already been going for several weeks now. So I just want to note that I had an opportunity on Sunday. We've had many folks. Of course, we have paid staff that work at those clinics, and then we have a lot of volunteer staff that volunteer their time, as well as residents who are volunteering their time at those events. I had an opportunity to volunteer on Saturday all day again, and just see the incredible coordination and the smiles on people's faces. The one example I'll share with you was a woman who celebrated her 93rd birthday on Sunday. And it came up because she rolled up and I was taking her information and I said, now, Pfizer can only go to people that are 16 and older, so I'm going to need to see your ID. And she chuckled, because that was my joke of the day for seniors. And she chuckled and she said, well, actually, it's my 93rd birthday today. And I'm trying to get to church, so if you could kind of move this along, that'd be great. And so that was just a brief example, but so many folks who are just, a lot of folks in the developmental disability, intellectual and developmental disability, long-term care and group homes that were coming through and getting their second shots. So we appreciate the community's patience. We're working hard to do everything we can to get vaccine to everyone in this community in an efficient and systematic way. And we're going to continue doing that every day of the week until this is over. So Mr. Adams, I'll turn it over to you to shed some more light on the details.
Okay, thank you, Steve. Chair Bernie, commissioners, good morning. It's a pleasure to see you, as always. I think I have successfully shared my screen. I'm hoping you can see. Okay, I figured it out from last week. Okay, wonderful. So starting with obviously the EpiCurve, and considering that we still have disease in the community. So as of last night, this is where we stood at 9,595 cases cumulatively. This morning, we have the new 24-hour report. We're now showing an additional 25 cases. So our total stands at 9,620. From an infectious tracking perspective, in the last 24 hours, we've shown a decline of 61 individuals, putting us at a total of 268. Our hospital numbers remain quite good. We have 13 hospitalized in Lane County, 3 of whom are in the ICU units. And that is a decline of 1 in ICU status in the last 24 hours. We've had an additional death reported in the last 24 hours, bringing us to 117. So we held firm at 113 for a full week, logging last week, the first week in which we had 0 deaths since late July, as I was reporting to you last time. But still and yet we have some of these issues in the community that we're continuing to manage. We're currently looking at 48 outbreaks under active investigation. And of course, with disease declines, it also has impacts downstream on our contact tracing and our case management ultimately. So we're currently showing 12 individuals at River Avenue. So those numbers have been down, and we have 0 individuals in hotels, either for isolation or quarantine. So pivoting obviously to vaccinations, one of the major, I think, accomplishments the team can report to the board is the launch of the countywide vaccination registry, which was officially announced late last week on Thursday. I pulled this report from our data this morning, and we had 61,697 individuals who had registered as of that moment. And I got a text just a few moments ago saying we're at 62,000 now. 087, so just over 62,000, 143 of whom are Spanish speaking. So this registry has continued to work. Despite the outage over the weekend of our primary website, our social media, we're able to point folk to this particular software, and we've continued to see registration rates, at times exceeding 600 every 30 minutes coming in. You can see some of the utility of this with the bar groups at the top. So of course, as Steve noted, yesterday, our 80 plus population became eligible. And we're now able to look specifically at the data that we have for the folks that are that have registered. So as of this morning, we had 6,947 individuals 80 plus registered. We, through a series of short questions, were able to identify those who are reporting having pre-existing conditions in that orange, blue, and light blue bar graph there. And that's stratified by the 65 through 80 plus populations. We are asking about race and ethnicity, so we can see what those data look like as well. And of course, we have location information, so we can see this countywide by zip code, and we're able to do things like overlay the social vulnerability index of the produced by the Centers for Disease Control to help us see other conditions of vulnerability that enables us to target our efforts for opening up and sequencing opportunities for registration. So obviously, in addition to many seniors who have access to the internet or have some tech skills and are able to take care of their own registration process, we recognize that many others are reliant on friends or loved ones to do that for them. And so Jason Davis, our intrepid PIO, has really been doing a lot of outreach, encouraging people to adopt a senior and do what they can do to help move them through. But even so, we recognize too that many individuals require a telephone or another way of getting to the information. So concurrent with standing up the registration link, we expanded our call capacity, our call center capacity, which you can see. I haven't shown you this graphic in some time, but I just want you to see some of the call volume. So, this was bumping along at relatively modest levels. As the vaccine rollout really ramped up, you see the kind of spike. So we've been averaging call volumes now in excess of 250, often 350. And if you go back and kind of do time signatures of when you see these spikes, it's typically around announcements from the state level of new levels of eligibility and others. But we've created the capacity of 10 new desks that enable us to take inbound telephone calls and do the registration process for those seniors who are not able to access the internet, or others for that matter, be able to give their information. And we have staff on hand who are doing the data entry into the form as well. And thanks to Mike Finch and his team, we created outbound call capacity with this call center as well. So when it comes time to reach out to 80 plus seniors, and so within these data that I had just shown you, we identified 300, somewhere in the neighborhood of about 330 who indicated that they could not they could not schedule a spot at a clinic but for a phone call to them. So we have the capability to reach out now and not let the digital divide challenge us. So as we move forward now, and just kind of giving you a status on where we are. As Steve indicated, we now have 33,175 individuals reported via the statewide alert system who have received a vaccination. That's 23,021 having received one dose, and now 10,000, over 10,000 having received both doses. So in that bottom line number, 33,000, that's an increase of 6,843 since my presentation to you last week. So in the bottom chart here is the actual doses administered, right? So the total doses that have been administered in Wayne County are 43,880. And that differs from the number above in that the folks who were fully vaccinated, that's times 2, right? They've received both shots. So that's 23,000 first doses, and then 20,000 first and second doses to get you to that 43,000 number. A goodly number of those you see in the color coding, with the darker colors being Pfizer and the lighter colors being Moderna. And of course, there is that kind of 72-hour lag. So some of the activities from the weekend are still coming forward. Some notable activities just hitting. As Steve noted, we had 2 days of drive-through activities over the weekend. We administered about 1,500 phase 1 first doses on Saturday at our drive-through facility. And on Sunday, we got 920 people through a second shot. And that was the first kind of conclusion at the Mass Vax clinic that we've done so far. I'm pleased to report that the average time from check-in to checkout was 32 minutes. And that includes the 15-minute wait time that most individuals are asked to wait in our observation lot after they've received their dose. And for those who have reported having had some adverse reaction in the past, we often will ask them to stay for 30 minutes. We had a convoy of buses from Sheldon Oaks arrive on Saturday, 3 buses in tow. They came twice, once in the morning and again in the afternoon. We closed down a couple of lanes and redeployed our Vax teams to go on board the buses and to administer folks. They were phase 1A, obviously, from a long-term care congregate facility, long-term care facility. And that was a lot of fun to see that. But kudos to them for finding a way to get people to vaccine. Another notable activity last week was going out to Fox Hollow. So I briefed you all last week, you may recall, on some of our research to understand the coverage through the state's participation in the federal pharmacy program that is going out and providing clinics at long-term care facilities, and the fact that that program was designed to largely cover the larger facilities, but a few fell through the cracks. One of those was Fox Hollow Retirement Center, and we sent a team out from Eugene Springfield Fire Department to take care of just over 50 individuals there. That worked really well, and that was yet another step as we continue to kind of build our Wayne County Vax Collaborative, where we're bringing all the agencies together to work seamlessly to get vaccine out. Another notable partnership working with Wayne Community College, the Quality Connections group, as well as our partners at UO and our public and private schools. We were able to get 3,600 doses of first shots out. 1,600 of those doses were distributed to the public K-12 school districts, covering all 16 school districts across the county. Many of them banded together and provided shots to staff across those districts. And then we allocated 2,000 of those doses to a walkthrough event at Wayne Community College that happened over 3 days. And that was primarily targeted for early learning and childcare sectors. There were some openings, and we were able to get some additional public school teachers through that line. So that was another kind of front on our experimentation, as it were, and our scale up of our various ways of getting vaccine to people, a walkthrough facility. So coming up this week, of course, 80 plus is the thing that we're most entirely focused on. So in our allocations from OHA, we were advised that we're receiving 2,000 doses of first doses of Moderna for seniors 80 plus. We're receiving 800 doses for the 1B population. So that will have to be allocated across the public, private, early learning and childcare facilities. And some of those allocations have already begun to think about how to get doses everywhere that they need to be. And then 400 doses for our remaining work to continue to advance our conclusion on 1A. We also took possession of 1,500 doses, first doses of Pfizer from Peace Health. that will support an 80+ drive-through clinic that we will be hosting this weekend. And we also now will conclude the series for 650 individuals who received a first dose of Moderna coming up on 4 weeks ago during our very first weekend of drive-through activities. We also have been working with the executive director of Churchill Estates over the last 10 days, working to see if we could get that facility covered through the federal pharmacy program. The federal pharmacy program has scheduled 2 of the 3 units within and cannot schedule the 3rd unit. So that leaves about 75 individuals not covered. So we're sending out the team on Friday to take care of that. So we're continuing to advance our efforts. The 2,000 Moderna plus, the 2,000 Moderna for 80+, we are working today to distribute throughout the county. So our kind of guiding philosophy, particularly as we are working with the 80+ population, is to try to get vaccine as close to the people as we can to minimize drive time or maximize convenience. And we have some new tools available to us. We have some new pharmacy chains that are coming into the distribution process. So we're in conversation now with Bimart, which has locations throughout the county, as you know. Fred Meyers is also coming online in the pharmacy process. So we're able now, we have new tools and new partners through whom we can get doses to. But it is our hope to take the 2,000, push that out as broadly as we can throughout the county, get as many people vaccinated as close to home as we can, and then continue to stand that up as we go through the kind of coming weeks. Finally, I'll just note that yesterday was wave 1, 80+. And so as you know, commissioners, we roll through this now on a weekly basis. So next Monday, it'll be 75+, and so on until we get through to the entire 65+ population. So as you know, in numbers, we know in Wayne County, we have over 50,000 in the 65+ category. And OHA in their press conference last week indicated that it will take us 2 months from now to get to the 75% mark for all of the eligible groups, phase 1A, 1B, and now the seniors. And their goal now is to be 75% through that entire eligible population by early April. And Chair Bernie, that is my brief for you all today.
Oh, I can't believe that's all you got to say, Steve. No, I'm just kidding. Commissioners, are there questions or discussion items for Mr. Adams? Commissioner Bozevich.
So, Steve, how many do we have remaining in phase 1A in Lane County yet to get a first vaccine?
So we don't have exact numbers, right? We have kind of population estimates of some of these, very hard to quantify. But if we look at the doses administered, so we've got 33,000 people having gotten at least a first shot, and a third of those having gotten a second shot. And if we kind of subtract what we know has gone to the 1B population, and I think very, very few 80+ people have been vaccinated at this point and showing up in the data. I'm going to say that we've got 28,000 of our estimated 40,000 1A people through the process at this point, having gotten their first dose.
So there's still over 10,000 in 1A that haven't gotten a dose yet.
That is correct, Commissioner.
Okay. I just wanted to confirm that number. I think it's what you told me on Friday, and I just wanted to make sure that was correct. So how many in the phase 1B1 educators group have gotten a first dose?
So in the 1B, so we think that total population, and there's a little bit of unknown in terms of the childcare facility group. So
not asking how many are left, how many have received the first
So
dose?
how many have received? Got it. So in that estimate, we are just over 5,000.
And from what your registration is, right now you have over 6,080 plus. Registered.
No.
Nope.
The answer to that question, Chair Bernie and Commissioner, is no.
How about restaurants?
I don't see that as a listed activity. I see we are reporting workplace, but that could be any number of different kinds of workplaces, but it's not broken out by the type of workplace.
Okay. Thanks. Just wanted to note that once again, we're not seeing fitness centers as an issue, but we're continuing to maintain them being closed or extremely limited to the point where they can't open financially. I don't understand some of the rules that are coming down. And I really just want to say, you guys are doing incredible work. You're getting all the doses out we're given, and even getting doses out that were given to other entities and redistributing them. It's just yeoman's work that you all are doing, particularly knowing that you're not getting notified of your dosage distribution until Thursday night or Friday morning for the following week. It's just kind of sad to see that we still have over 10,000 left in 1A, but we're only given 400 doses for 1A. Something just seems a little bit wrong with this picture, but I just want to say I really appreciate the work you're doing, the work our public health staff are doing, doing incredible. 33,000 people vaccinated in such a short time, and the work you're doing is just incredible. And I just want to say thank you.
Commissioner Farr.
Thank you, Chair Bernie, and thank you, Steve Adams, for the wonderful report. You know, I contend, and I've always contended, that one of the greatest roles that the Board of County Commissioners has is to distribute the information regarding what people can expect. And you continue to give us up-to-date information on what has happened, which helps us more easily to project what is going to happen. And what I typically report on, Steve, is that that Lane County has experience in mass vaccination. We continue to gain experience in mass vaccination. And I can now report, and this is kind of a question and a statement at the same time, that as we are administering vaccinations, we're doing it in a variety of forms. We're trying to get the vaccine as close to where people live as possible. That's the statement you just made. And we are being flexible in how we administer at the central sites, including actually going on the buses to administer the vaccinations. So can you bolster my confidence that we are continuing to get the vaccination to people as quickly as we get it? Is that, can I report that accurately?
Chair Bernie, to the Commissioner's question, yes, thank you, Commissioner Farr. We fully get a standing objective in our incident action plan is to have every dose out by 7 days of receipt. And we exceed that every week in terms of day of delivery and day of departure. If we're not administering doses, we are getting them out the door. We've only had a couple of instances in which we've taken possession of both from other parties. We've taken the first dose and the second dose at the same time. So we've had to store the second dose, obviously, to ensure that it's there. But that's the only time when we've not hit that performance mark.
I've also been reporting that we're not letting any vaccine go to waste. Is that still an accurate statement and continues to?
Indeed.
And significantly, as we get more vaccine, the pressure to vaccinate, the pressure to continue getting the vaccine out as quickly as we get it is going to be there, because we're going to get far more doses than we experience today. Can you talk a little bit about how we're going to handle the expansion of the pipeline?
Chair Bernie, and thank you, Commissioner Farr. We are essentially building each of these platforms for scalability. So we're establishing each of the clinical distribution networks, now the pharmacy networks, recognizing how we will move in the future. So as the vaccine supply grows, we will be requesting increasingly that OHA deliver directly to these other sites, right? So it won't necessarily all come to us for us to redirect out. It works now because we're able to target, and from a scarcity perspective, we're very keen to do that. But as it grows and becomes increasingly available, we will want to see distribution happening across the county at sites so that folk can continue to get vaccine out and providing central support and direction as we go. We are looking carefully at our capacity as well, and just looking very specifically from a facilities perspective and from a staffing perspective. We currently have 10,000 doses a week capacity within Lane County. We can move 10,000 doses a week. That's pulling in our partners. From a facilities perspective, we have a great deal more. And so now it's just really kind of the other piece is bringing in the human power to help to do that, right? So that is very much a part of our focus. And then growing some of the novel approaches. We've got some very low efficiency targets that we're going to need to go out and do. 5% of adult foster care facilities, for instance, is going to take a lot of road miles to get some of that done. But now we're scaling up our capacity and our experience of working with mobile teams to go out and be able to address those communities as well. So it's really a multi-pronged effort, and each week, we continue to kind of add new tools to our process, try them out, learn from them, improve them. But our kind of guiding philosophy here is the vaccine rollout is chaotic globally and nationally. And we want very much for people coming into the piece that we can control to have a sane, rational process so they can move through our drive-through clinics, for instance, in a speedy way.
Thank you. And that was the nature of my stream of questions there, is to ensure that we anticipate the potential for chaos and that we're doing what we can to, as you stated, build the platforms to absorb the chaos and keep it as reasonably ordered as we possibly can here. And I want to thank you for that. You particularly boosted my confidence regarding the facilities as you talk about pharmacies and other places that we can administer. I still have questions regarding how we're going to be training enough people to administer the vaccine when the time comes, and particularly when you have small populations, inefficient vaccination methods that are going to have to be employed, which each require more people. I'll ask more questions on that probably at our next board meeting as you get more information, more confidence there. But I wanted to point out that you talked about pharmacies, and just very quickly, Chair Bernie. Did you notice that Mr. Adams called Fred Meyer Freddy's? Now that's a true sign of a real deep Oregonian. Well done, Fred Meyer's Freddy's. I just want to point out my mother-in-law worked at one of the first 2 Fred Meyer stores in Portland and Hollywood, and Mr. Meyer used to come in the store every day. She never called him Freddy, by the way. It's always Mr. Meyer. But thank you for the confidence you've given to me. I know Mr. Mokrasky spent the entire day on Sunday at the event center, Vaccination Mass Clinic. I was going to try to get there myself, was not able to be there, and he personally told me that things went well and went smoothly. He may have something to add about that. Chair Bernie, thank you. Steve, thank you very much.
Thank you, Commissioner. I know that Commissioner Buck has been wanting to say something. Commissioner?
Thank you, Chair. When I was going up the McKinsey this weekend for the resource fair, I drove by the fairgrounds on the way, and things looked like they were going swimmingly. But even I was heartened because up there, the resource fair was at the schools, and so I heard from folks up there who, since they work at the schools, and we know that schools are starting to reopen many locations, they were able to get their shot that morning, but it was at Hamlin. I think the teachers and whatnot were doing it in a separate location. And I think not only was I heartened because I know I really want to see vaccines in people's arms, but also because this was a rural community, and we're really ensure that our rural communities are getting vaccines as well, knowing that we have a lot of transportation issues, especially for low-income seniors who can't get around very well. So I'm quite happy to hear about the mobile units. And what my ultimate question is, what is our plan to get out into our rural communities? Because what I don't want is the expectation that everybody has to come into town in order to get a vaccine.
Absolutely. Chair Bernie, Commissioner Buck, indeed, that is a key issue. And so one of the ideas for moving in that direction, and as we get further into the senior waves, it is something that we wish to deploy. So search and rescue has the capability of going and setting up an appropriately scaled drive-through facility in some of our smaller towns and being able to take care of folks. All they need is a tarmac to set up on a parking lot, and we can get that done. So we're looking at that as well. And we're looking, in order to do that, and depending upon time of day and use, we also have to free them up from the mass vax sites as well, because they've been providing a lot of the support there. So to kind of prefigure Commissioner Farr's question, it's bringing in other additional people to backfill for them and free them up to be able to go out into the county and bring vaccine to where the people are.
Any other, oh, I'm sorry. Yeah, well, Commissioner Trieger, would you like to speak before Mr. Mokrahajski?
Thank you, Chair. I really mostly just wanted to, while Mr. Adams is on the call, again, restate how much I enjoyed being out on the site Saturday, pitching in for a couple of hours, how impressed I was with the operations. I was happy to be there for the last couple of hours and be there to help folks with teardown and give a little relief, hopefully, to people who had been working out on the concrete in the elements all day long. And as someone who's worked in the service industry, I mean, this is really a service industry job that we're doing, right? Public facing, trying to get people in and out quickly. A lot of people with a lot of anxiety around this issue generally, and specifically around needles and shot. There's a lot to contend with, and everyone without exception that I encountered and chatted with was just had a great attitude and was compassionate and really truly working as a team. It was great to be there at the end to see the consolidation of lanes as traffic diminished, and just how smoothly, again, also as someone who's been part of large events, the logistics involved are pretty daunting, but we're really just doing a phenomenal job. So I want to give that appreciation directly to you, Mr. Adams, for that. And to note the incredible efficiency, right? You said we did something like just shy of 1,500 shots on Saturday. And what I observed being there at the end was, in terms of efficiency of using every dose has been brought up before, I think we turned one person away, right? We were one dose shy, and we didn't want to open a vial of 5+ doses to serve that one person. That is how tight the coordination is relative to the scale of how many shots overall in just one day. So that's really impressive and really something to feel great about. And then also I got to be there for some of the informal sort of debrief and hear how we're just continually improving based on what we learned each day that we run the clinic to make it that much better the next time and moving forward. So thank you so much for that. I had two quick questions. One, I know we had lanes designated for Spanish language speakers, and I'm wondering if you can share the utilization of those. And I know we talked a little more about doing some more robust community outreach to serve that population. So that's my first question. The other's about the pharmacy program.
So Chair Bernie, thank you, Commissioner Trigger, and it was a delight to have you on site. I cannot answer that question. I mean, I can tell you just anecdotally that I saw cars in that lane throughout the day. I know that they weren't necessarily serving singly Spanish language individuals. So all of our staff that were in those lanes were bilingual. So I would have to go back to the staff and see if we could pull that number. We were taking data by vaccination stations, so we could see how, the efficiency rate of the individual vaccinators themselves and understand and learn from that. But I would have to pull that data and get back to you on it.
Great. Thank you so much, Mr. Adams. My other question is about, just if you could clarify for me, the federal pharmacy program is for, at this time, long-term care facility residents only, and the doses come to Lane County Public Health and then we deploy them out to the participating pharmacies, or are they on their own track and allocation track directly from the state?
So that process is the state opts in, the participating pharmacies, CVS and Walgreens and a couple of other subcontractors receive their allocation off of the top of the state's allocation. So they get their doses first, and then the remainder are allocated out to the counties and other recipients.
Great, thank you.
I'm very aware that Mr. Mokrahysky was trying to clarify some things. I apologize, Steve, but please.
Oh, that's fine. I just wanted to, share some additional information as it relates to both outreach to rural communities and the equity lens that we are working really hard to apply towards how we distribute vaccines. So I want to just shed a little bit of light on, some of the discussions that we are regularly having among our policy team. And I'll give you an example. When phase 1B, group 1, K-12 early learning childcare came forward, we had a lot of discussions about public school, private school, who should go first. In terms of the early doses, because our policy really is, we want to make sure whoever is ready, like we're going to get those, we're not going to sit on doses and wait for plans to come forward. We're going to move as soon as we receive doses, we're going to move and get them in arms. So it's both about planning and mobilization, as well as who's really most critical. And so certainly a concern about, the number of students in public schools that qualify for free or reduced lunches. Very much a concern about making sure that we get our rural schools are represented by Lane ESD and the metro areas. As we then moved into, in particularly for the 80+ population, we've had a lot of conversations about issues around access. So, things like, should we have the doses run through private clinics? Is that easier for folks who are in those senior categories to go to their primary care provider? Or is it easier for them to come to a mass vaccination clinic? And we really settled in this first week on, let's have a portion of the doses that Peace Health allocated remain with Peace Health so that they can run them through their clinics, because actually Peace Health is set up in a lot of our rural communities better than we are, right? So in Florence, for example, Peace Harbor is there and they have clinics set up. And so we've really leaned on Peace Health with the 80+ population in the rural communities in Florence and in Cottage Grove in particular. And then we've said, the mass vax clinics, actually, we had some debate about this, but we feel like the mass vax clinics for the 80+ population, I gave the example of the 93-year-old woman who drove herself, that driving in their car, not having to get out of their car and walk into a clinic and sit in a waiting area, that actually many of these individuals, 80+ individuals, are going to have family members or other caregivers that are going to bring them, and having them in their car and not have to get out is actually less of a barrier. We've further talked, and I mean, without going into too much of the nitty gritty, but I just want the board to know that we are looking at these equity issues. Mr. Adams has looked and really filtered among those folks who've done pre-registration, the social vulnerability index, zip codes. So who are those folks? And we can actually look at, race and ethnicity in identifying those areas. And then as we move forward, yes, every Monday we're having a call with the city managers of all the cities throughout Lane County are welcome to participate. And we had this conversation with them, with the city managers last night, and invited them to come to our MassVax clinics and say, you all really should start to get comfortable and start developing your own plans for how you, in Florence, what are you going to do as doses become available? And of course, we want them to go to pharmacies and to clinics, but also the governments, cities and counties really need to be the ones to fill the gaps for individuals that don't have a primary care provider at private clinic, right? That don't have the same access. And so the lens we're trying to use as a county government, and we're encouraging our city partners to use, is let's make sure that we're looking out for individuals that maybe don't otherwise have access, and we're creating that access through these other MassVax type clinics. And so I just want to share that. Commissioner Farr and Commissioner Buck both asked about how are we getting out, how are we getting out to these different communities and making sure that everybody has access, that we really are getting to the very nitty gritty aspects of making sure that everyone in our community, particularly those who don't have anyone else who's watching out for them, that they are going to have access, and that their local government agencies are going to be watching out for everybody in the community and make sure that they have access. So we're happy to provide more detailed information about that, but I just wanted to shed a little bit of light around the conversations that are happening behind the scenes to make sure that those equity pieces are covered.
I think it's called logistics. And I think that the logistics attendant to this, for me at least, not only demonstrate a focus on solutions, but they demonstrate a bias toward action, and they also demonstrate leveraging existing infrastructure, all of which I'm speaking for myself, I'm thoroughly impressed with. Mr. Moker, I see you referred twice to a 93-year-old lady. Did you card her?
I did not card her. I joked about carding her, but I trusted. I'll tell you, she's probably in as good or better shape than I was. So I'm not sure, but I trusted that she's 93.
I would like to share with this, well, before I do, Mr. Adams, if I got information from your presentation correct, it looks like Lane County there are almost 44,000 people currently having received a first shot in Lane County. Is that correct? Your site said 43,880 when you added up the hospitals in the county.
Yes, sir, Commissioner, Mr. Chairman, the 43,000 total doses. So if you look at the people, 23,000 have gotten just a first dose. And then 33,000, if you add that, then that's 33,000 people have gotten shots.
Oh, 33,000 total?
Yes. So that chart, the data presented by OHA on this is a little wonky, but 23,000 21 individuals as of midnight 01 this morning through the alert system have had one shot, and 10,154 have had two shots, with 33,000 having, that's the people.
So based upon, no, that's fine. So based upon what I heard as of last night, nationally, about 10% of the population have gotten shots in arms. Are we right at that? Are we a little behind that? Or are we a little ahead of that?
So 10% of 37, that'd be 37,000, right? If we were to hit that 10% mark. So we are behind by a couple of percentage points.
Okay.
And one thing I just would say is our total population is around 380,000 in Lane County, but we have to take out 16 and under for any vaccine.
That's what I thought.
Right.
Yeah.
Yes. So there's this kind of up to 16 or up to 18 population. I don't know how many people. There's probably 100,000, Steve, 80 to 100,000 residents in that. So, and then there's a portion of the population we need to assume is not going to get vaccinated because they would choose not to. So when we think about percentages, think about, you're probably in there, I don't know, Steve, if we have a number for this, but if it's 280,000 adults in Lane County, that's the group that we're after.
And we do have that number, but Steve, I don't have it right here in front of me, but I can follow up with that.
That's fine. Another question, if I may. We all received from the governor's office yesterday, sort of the current county by county where things are. And I don't have it in front of me, and I apologize for that. But my recollection was Lane County was under, our trajectory was in a positive direction. It was going down. Aren't we under the 300 cases? Before I can even ask the question, I see Commissioner Bozovich just shaking his head and saying, no, you're wrong. Am I wrong, Commissioner?
The extreme level is 200 cases per 100,000, and we're at 209.6. We're 27 cases over the limit, and there were 259 cases at U of O in the last 2 weeks.
Right. So if we could just like eliminate a couple of nursing homes or the U of O or some other institution, we could get down there. But we are where we are. I would like to just focus on the phenomenal job that you are doing, utilizing every resource at your disposal, getting information at the last minute, right, in terms of doses and targets. I cannot believe the average appointment time for getting into 30 and 40,000 doses is half an hour. It's just inconceivable to me. And I just want to compliment all of you and everyone we're not seeing in this discussion and everyone that's supporting all those people. This is a Herculean effort, and I'm really, really proud to be affiliated with this group doing our best for our residents. I have no other questions. I don't have, that's for you guys, not for me. Do any other commissioners have any other statements or questions for Mr. Adams or Mr. Mokraheisky on this topic? Very good. Thank you so very much.
Thank you, Chair Bernie, commissioners.
We are now on item 6, and now I understand why the consent calendar, why Commissioner Bozovich wanted to make sure, because at least at the agenda I'm looking at, it still has, Commissioner, I think it was 6D, is that correct? Or, yeah, 6D, number 1, that you want removed. So we are removing that from the consent calendar. And is there any discussion or a motion? Commissioner Farr.
Chair Bernie, I'm prepared to make a motion if you're ready for that. Prior to making the motion, however, I will state that I will declare a potential conflict of interest on one of the items, which is actually item C1 on the consent calendar, which is approving a contract for Trillium. I've been advised that I do not need to pull that from the agenda because I do not perceive a actual conflict of interest, a potential conflict of interest in that my wife works for Trillium. So I'll move forward with the motion if you're ready for that, Chair Bernie. I'll move to approve the consent calendar for February 9th, 2021, pulling item 6D1 for separate consideration.
Second.
It has been moved by Commissioner Farr and seconded by Commissioner Buck that we approve the consent agenda, having pulled item 6D1. Is there discussion to the motion? Hearing and seeing none, all those in favor of the motion, please signify by saying aye.
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 Aye. Opposed? And the motion made by Commissioner Farr and seconded by Commissioner Buck is approved unanimously 5-0. And now we have item 6D1, which is to authorize Lane County to sign on to a coalition for a stimulus investment in electric vehicle infrastructure. Commissioner Bozovich wanted this pulled for discussion. Commissioner, would you like to start the discussion?
I mostly just wanted it pulled because I didn't want to vote no on the entire consent calendar. I will be voting no on this item. We're asking the federal government to get itself involved in the economy and pick winners and losers. It's beyond the enumerated powers that the people granted the federal government in the first place, and it only adds to our federal deficit. I can't support being a part of this coalition, no matter what the goal is.
Okay. Yes, Commissioner Farr. We can't hear you, Commissioner.
Thank you, Chair Bernie. I was prepared to make a motion whenever you're ready.
Was there any further discussion? Please, Vice Chair Farr.
I move passage of item 6D1 from the February 9th consent calendar.
I'll second.
It has been moved by Commissioner Farr. And I believe seconded by Commissioner Trieger, is that correct? That item 6D1, Public Works, authorizing Lane County to sign on to a coalition for a stimulus investment in electric vehicle infrastructure. Is there discussion to the motion? I can tell the group that this was referred to us by the Climate Advisory Group. It was unanimously recommended by that body to bring it to the board, recommending that this be signed. And I'm only sharing that as a member of that body. And I recused myself from that vote because I knew it was coming here. If there is no further discussion, all those in favor of the motion, please signify by saying aye. Aye.
Aye.
Aye.
Opposed, same sign.
Nay, sorry.
I know I should stop saying same sign, I'm sorry. It has been the motion by Commissioner Farr and second by Commissioner Trieger to authorize Lane County to sign on to a coalition for stimulus investment in electric vehicle infrastructure has been approved now. 4 in favor, 1 against, voting against Commissioner Bozovich. Okay. We are now at item 7A, and we are also 15 minutes away from an 11 a.m. certain executive committee meeting. Mr. Dingle, are you here for county council announcements?
I am, Chair. There is an exec session at a time certain at 11 o'clock. I just wanted to take a minute to briefly update a couple of the other assignments that the board had made. I am working on the 2 executive session requests, one related to the City of Eugene payroll tax, the other one related to the star voting measure. I'm conducting legal research on both of those, and as soon as that research has been completed, I will schedule the executive session. And that's all I have by way of announcements. Oh, I did want to tell Commissioner Bozovich that there is one other petition circulating. I did check with the clerk. There's star voting and one involving Second Amendment rights. Those are the 2 county measure petitions that are currently circulating.
Mr. Dale, you're free to say no to this, but were you going to mention something about the request for a work session on $15 an hour minimum wage?
Oh, yeah, I think Mr. Mokrahajski was going to do that, but I can certainly do that.
I apologize.
That's all right. I'll let Steve do it. He was planning on doing it.
Sorry,
right.
Steve, didn't you take your thunder?
That's all I have, Chair.
Thank you. County Administration. 8A, Order 21-02-09-07 in the matter of referring a 5-year local option levy to the voters to support OSU Extension Service programs in Lane County and directing the county clerk to place such a question onto the May 18th, 2021 election. We have with us Jillian Drews and Richard Riggs. Would you like to take it? Whichever of you would like to start. Hey, Richard.
Thank you, Commissioner Burney. I'm happy to chat, and I see Jillian's here as well. We appreciate the opportunity once again to address the board on this issue, and we have been meeting as an organization with the Friends of Extension group, which are a number of our volunteers who have pledged their support for this levy should it be referred to the ballot for the May election, and they're actively organizing and engaging a strategy to help move this forward. So I'm happy to discuss extension if there are any questions. I know we've already done that multiple times, so I'll just leave it to the board to if there are any questions. Jillian and I are here to answer those questions.
Board, are there any questions for Richard or Jillian? Commissioner Trieger.
Thank you, Chair. I just wanted to say, as I mentioned at our last conversation about this, what a supporter I am of extension. I'm especially familiar with, as I think many people in the community are, of the nutrition education programming, master gardeners, master food preservers, and so on. In the cover memo, it talks about our board goals and highlights the importance of some of those programs. This is also a really important strategy in our community to address some of our climate goals with the master recycling program. It's an event staple when we get to have events again, to have master recyclers there with doing important landfill diversion efforts. But I did want to share, I had a great opportunity yesterday to follow up with a new member of the Fair Board with Extension who does the 4-H programming, and just learned so much in just my half-hour conversation about not just the programming of 4-H, but given COVID and everything that's happening and the trauma families and particularly youth are experiencing, how much these programs help youth understand their own resilience and perseverance and the support that it provides, particularly to non-traditional students in our community, which then also feeds back into our equity goals as a board and as an organization. So I just wanted to give another shout out to the importance of the programs and the breadth and depth of programming that Extension provides. And at some point, I'm not sure the right place in things, but I will also want to talk about our role and the opportunities to help the community understand this measure and its importance. There's been some conversation started about producing a voter pamphlet or not. And as we see how many issues may be on the ballot for residents of Lane County, in addition to community college and other special district elections, I think that's going to be a really important conversation for us to have. That's all I wanted to say for now. Thank you.
Thank you. Are there any other commissioners that would like to make a comment or a question? I see none. Is there a motion? Commissioner Buck.
I'll move approval of order 21-02-09-07 as presented.
I'll second.
Order 21-02-09-07 has been moved by Commissioner Buck, seconded by Commissioner Trieger. Discussion to the motion? Seeing and hearing none, I will call for a vote. And Commissioner Bozovich, I won't be so confusing this time. All those in favor of the motion, please signify by saying aye.
Aye.
Nays? Order 21-02-09-07 made by Commissioner Commissioner Buck, seconded by Commissioner Trieger. It has unanimously been approved 5-0. Richard, Jillian, thank you both very much. It's been a long multi-year process, but it looks like you're getting there.
Thank you very much, Commissioner Burney and commissioners. We really appreciate your support.
Thank you both. Bye-bye. I think we have time. It looks like we have time. Steve, Mokrahysky, do we have time for item 8B before we have our 11 a.m. time certain?
Yeah, I think so, definitely. Do you?
Wait, yeah, I think so,
I was
definitely.
just looking at the clock. I think, yeah, we've got 10 minutes. I don't think it should take more than 10 minutes. I'll just make a comment. I think Mr. Dingle is here too, if we have.
Order 20-02-09-08, in the matter of extending the declaration of a local emergency as a result of public health response to COVID-19. I'm sorry, sir, take it away.
Yeah, no, that's fine. You've had this item before you in the past. Something that we're doing here is actually extending the time frame so that this doesn't have to come back to the board quite as regularly. The state has extended its declaration of emergency. I know that in the past there's been confusion about what this does. The governor's list of counties with risk doesn't have anything to do with our own emergency declaration. This declaration that the board has sort of routinely made throughout the pandemic really allows Mr. Adams, who you just heard from in the COVID-19 update, and the team of public health officials and other folks throughout Lane County that we have supporting our emergency response in the community, doing things like contact tracing and testing and vaccination clinics. It allows us to be able to coordinate, to allocate resources necessary to respond to the needs on the ground as it relates to this pandemic. So I just want to provide that clarity, because I know that by the county declaring this emergency, it's actually perpetuating the restrictions on businesses in the community. It really has nothing to do with any impact on businesses or schools or anything else. It really has to do, this action that you'll take here today has everything to do with Lane County's ability to mobilize and spend resources and respond to the needs of the community during this pandemic. So that's that. And Mr. Dingle, I don't know if you have anything to add. Otherwise, if you have questions, commissioners, we can answer those.
Chair Buck and commissioners, no, I don't really have anything to add. I just want to emphasize, you see the reasons that are set out in the for the extension as far as it is. I want to emphasize to folks that should that schedule change and the need no longer be there, the emergency declaration can certainly be repealed. I know there was concern from folks, well, what if, I don't know, there's suddenly a huge influx of vaccines and everything is done by April 1st. Well, then you could terminate the emergency declaration. That's all I have, unless the board has a specific question.
Commissioner Buck, since Mr. Dingle made you chair, would you like to moderate this session? Sorry, had to do it. Commissioner Trieger, yes.
Briefly, I'm going to assume, Mr. Dingle, that the fact that we could shorten the time means we can also extend it if need be, not to be the Debbie Downer of the morning, but September feels both very far away and also right around the corner, given where we are relative to what still needs to be done. And so I'm just wanting to make sure that we're not overly limiting our ability and make sure we can bring an extension back quickly enough to be effective if we need that.
All right. Chair Berney and Commissioner, that is correct. You have complete control, and it just depends on the circumstances on the ground. And quite frankly, that time period was selected in consultation with public health and everything, based on all the circumstances as we know them at this time, but certainly shortened or lengthened depending on the facts.
Thank you. I couldn't tell, did Commissioner Bozovich have his hand up? No, okay, I'm sorry. Any other commissioners like to make a statement? Oh, Commissioner Farr, I'm sorry. Yes, sir.
Oh, yes. I've been married to Debbie for 47 years now, and she's not a downer.
Thus far in my 2.5 years or so as commissioner, only Commissioner Bozovich had that self-deprecation and said he hates to be Commissioner Wet Blanket, but now you might have company, sir. Are there any other questions or comments? The chair is looking forward to hearing a motion. Commissioner Buck.
I'll move approval of item 8B, order 21-02-09-08 in the matter of extending the declaration of local emergency as a result of public health response to COVID-19.
Is there a second?
I'll second.
Okay, order 21-02-09-08 has been moved by Commissioner Buck, seconded by Commissioner Trieger. Is there a discussion to the motion? Hearing and seeing none, all those in favor, please signify by saying aye.
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 Opposed? Nay. And the motion is approved unanimously, 5 votes to 0. I think at this point, we should probably recess. We have a separate link. Oh, I'm sorry, Steve, go ahead.
Well, no, I'm happy to. I just had one announcement, and if I can do that, then we're done with that. You can roll right into the performance audit committee when we come out of exec session.
Chair Bernie, I've been in contact with Ms. Miller, and she can wait until after the executive session.
Very good. Go ahead, Steve.
Yeah, I just was going to update really briefly on the $15 minimum wage, and we had this discussion at the agenda team meeting this morning. I want to just provide a brief update for the board. There are a couple of, it is still an assignment. There are a couple of factors that are in play that have sort of delayed, in addition to all the stuff that's going on around COVID-19 for the last year. But one is pay equity. So we have this pay equity law that the legislature approved in the 2019 session, and we've been working on really for the last year and a half actively with a consultant to do a ton of work with all of our employees, filling out PDQs and answering questions and doing analysis, and we're still in that process. Anytime we make an adjustment, so if we were to make an adjustment and say we're going to have a $15 minimum wage in Lane County, and we would then move up a group of employees that that are less than that, it would trigger additional analysis that needs to happen as it relates to that pay equity work. So that's one factor that has sort of played into this is given the sort of the vast scope and impact of pay equity. We've wanted to go through that process and have the results of that come forward to the board, and then have you be able to consider any additional policies in that context. The other issue, sort of outside of our control, is this discussion at the federal level in Congress right now. Both the House and the Senate have passed sort of different versions of a stimulus, $1.9 trillion stimulus package that still is going through a reconciliation process. And there's uncertainty about whether or not there will be a federal $15 minimum wage as part of that. So those two factors, both pay equity and what's happening at the federal level, I think have just caused us to be like, let's try to be thoughtful about the timing of what we bring forward, and that it isn't either in conflict or trigger something that is going to create a lot of additional work. So we're certainly happy to provide a more detailed update to the board with information on that if you'd like to hear a more detailed presentation, but I at least wanted to provide that context that the ball hasn't been dropped. It's just that there are some other things that are in play currently that could potentially impact ultimately that policy the board could consider.
Thank you. In that it's 10:58, may we resume at literally 11:03 so the commissioners can have a 5-minute break, or do we need to start at 11?
I think that's fine, Chair. You can certainly take a 5-minute break, and then we'll get ready to be set up a couple minutes after 11.
Thank you both. And let's take a recess. We'll reconvene in 5 minutes in executive session. Thank you.
Chair Bernie?
Yes.
Bernie?
Oh, we have to be read into executive session. Diana, I apologize. Would you please do the honors?
Yes. One moment. My computer will let me get my script up.
Well, you knew this was coming, and now Commissioner Bozovich is laughing at me, so I would really appreciate it.
Okay, here we go. The Board of County Commissioners will meet in executive session to consult with legal counsel regarding the rights and duties of a public body with regard to current litigation or litigation likely to be filed. This executive session is held pursuant to ORS 192.6602H, which allows the Board of Commissioners to meet in executive session for the purposes listed. Representatives of the news media and designated staff shall be allowed to attend the executive session. All other members of the audience are asked to leave the room. Representatives of the news media are specifically directed not to report on any of the deliberations during executive session, except to state the general subject of the session as previously announced. No decision may be made in executive session. The board reserves the right to come back out into public session should the need arise.
Thank you. We'll see each other in 5. you froze, just to let you know. I don't know what. We are now, you're good. We are now resuming our February 9th, 2021 Lane County Board of Commissioner meeting. We have left executive session. We are on item 9A, Commissioner Business. We have discussion in the matter of reviewing the Performance Audit Committee 2020 Annual Report. And Commissioner Farr is joined with Shanda Miller to lead us in this discussion.
Thank you, Chair Burney. My part will be very brief in this, just a quick explanation. The Performance Audit Committee is required by our charter to provide a report of the Board of County Commissioners annually. This will be our annual report. There was very little activity other than the Performance Audit Committee did meet throughout the year. And recently we elected our former Performance Auditor, Shanda Miller, is now the chair of the Performance Audit Committee. And I will turn over the balance of the meeting to Shanda. But before that, I'll say that it is really truly wonderful having Shanda not only on the committee, but chairing it. Because of her experience as a performance auditor, she really lends the entire committee a great deal of both historical perspective and also expertise in the subject matter. So at this point, Ms. Miller, I'm going to turn over the report to you. Thank you for being here today, Shanda.
Thank you. Thank you, Chair Burney, Vice Chair Farr, Commissioners Bozievich, Buck, and Trieger. It's good to see you all. First, I'd like to share that the Performance Audit Committee, as presented in the annual report attached to the agenda, is fully committed in pursuing the recruitment of the next county performance auditor. And the committee also recognizes the current emergencies the board is focused on right now, and also the current hiring chill. And the committee wants to share that when such time is appropriate, the committee is ready to assist the board in moving forward with decisions related to successfully recruiting the next county performance auditor. Before I continue with the work of the audit committee in 2020, performance auditor and all recruitment and appointment of a county performance auditor for 3 reasons. First, having a full-time position dedicated to looking for risks is critical for a county government of this size. The auditor looks for risks, and with an independent and objective review and analysis of evidence, makes recommendations for reducing risks. And so what do I mean by risk? So risk in this context is the risk that county programs are not meeting their objectives. Or another way to say it is the risk that programs are not meeting their original purpose or intent, or they're not getting the intended results. Second, the opportunities for fraud, waste, and abuse in any organization are huge. Even letting people know that they are being watched can be a huge deterrent. Third, the auditor is appointed by and works for the board in overseeing the effectiveness of management, in implementing internal controls, and ensuring effective and efficient meeting of program objectives. So next I'd like to share, and I believe I speak for the audit committee on this, that when the board and the county is ready for the process for recruiting for the next county performance auditor, it's important that we get this recruitment right. And I'm remembering I listened in at the February 25th, 2020 Board of County Commissioners meeting, so almost a year ago. And the board discussed the performance audit function at that meeting. And I remember a few points of that discussion related to the importance of getting this hire right. And so with that in mind, the Performance Audit Committee in 2020 set out to review compensation and recruitment and has provided the board with its recommendations regarding minimum qualifications, recruitment strategies, position classification, and look forward to working with you on these again when the board is ready. And then one last point that I'd like to make is that it is important to recognize that there is a normal or natural friction between the audit function and management. And so understanding this is important when you as the board are making decisions regarding the audit function and regarding the recruitment of the county performance auditor. So I hope with that you will rely heavily on the Performance Audit Committee for its advice and input when making these decisions. And with your approval of the consent calendar earlier today, there are 2 new members to the Performance Audit Committee that have been appointed, and the committee is now made up of 2 current auditors, 1 former auditor, and 1 current treasurer and controller with a strong understanding of internal audit and performance audit. So I think the committee is in great shape in helping you move forward. And with that, I just thank you very much for your time in allowing me to make these remarks. Thank you.
Thank you, Shanda. You're the one that's giving of your time. I can't quite tell, but I'd almost guess you might be in a RV or something. Is that correct? Are there any questions,
Yes.
comments for Shanda from commissioners? Commissioner Buck. Oh, I'm sorry, Commissioner Buck.
I just wanted to appreciate, as I was reviewing the 2 new members that we had in our consent calendar earlier, both were from East Lane and rural communities. And so I'm really pleased to see all their expertise and them being able to join the committee. I think that'll be a great asset to the committee.
Good lobbying job, Commissioner Buck, to get those appointments. Are there, Commissioner Farr, you had your hand up, sir.
Oh, thank you, Chair. Just to add that the 5th member of the Performance Audit Committee is by charter a member of the Board of County Commissioners as a voting member. That has been me since the outset of the Performance Audit Committee, and the board reappointed me for this coming year as the board representative on that committee. It is a voting position, unlike some of the committees that we are members on. But you know, the 2 new additions to the Performance Audit Committee give us a great deal of expertise and background in the actual function of performance auditing, which is really a benefit. So, Ms. Miller, thank you very much for your presentation. Good job summarizing and really outlining what we have as a Board of Commissioners on the horizon. When time permits and when it's appropriate, we'll move forward with the next step of the Performance Audit Office. Thank you.
Thank you.
Thank you. Yes, Commissioner Trieger.
Thank you, Chair Bernie. Excuse me. Thanks for being here, Ms. Miller. It's good to meet you in person. And I appreciate your presentation and the report. And I know this is just a discussion for today, and I am still learning and understanding the opportunities of having an auditor. And thanks for flagging the date. I wrote that down of last year's discussion. I'll go back and watch that. That'll maybe help give me a little more grounding as well. And I'm looking forward. I don't know if this will be another agenda item at another time for us specifically, or if this will get folded into our strategic planning work that we're likely to embark on a little later this year. Is for me, I'll want to have more discussion and learn the goal of an auditor, of having an auditor, which is different than what the auditor does, but what are we hoping to achieve by having one in place? I know in particular, one of the most important changes that's been made is having the fraud, abuse, and waste hotline in place. So learning from what kind of calls are coming into that and what kind of changes we're making as a result is really important. So that's something I want to learn a little bit more about, how those calls are responded to and what we're learning there. And I also recognize, and this is a conversation I know you all started during budget cycle last year, around program evaluation and data analysis. So I think there's just a lot for me still to learn about what the opportunities are. Maybe they're already in place, the systems that are already in place, the data programs are already gathering to be compliant with funding and other mandates, funding streams and other mandates. so that it'll just help give me more grounding in what's missing and what the goal of an auditor position is in particular. But finally, I want to really appreciate, Ms. Miller, you pointing out that this decision is now potentially being made in a very different context, given the emergency of COVID and the long-term recovery that we'll be facing there, as well as the wildfires. And I think we also can't ignore the context of the reckoning around racial and social justice and our organization's commitment to equity, and how all of that blends together in this decision, and ultimately what path forward we choose and how we proceed with the hiring, if in fact we do. So I appreciate you bringing the context in which we'll be facing making this decision later this year. Thank you very much.
Thank you, Commissioner.
Thank you.
Are there any other comments or statements or questions for Ms. Miller?
Chair Bernie, on a final note, if I may.
Certainly.
Just a word of thanks, not a word of thanks, but a chorus of thank you to Dennis Hidgmans and John Borowski, who both completed their term on the Performance Audit Committee. Actually, Dennis Hidgmans resigned a little bit early in his term to allow for the two new Performance Audit committee members. So both Dennis and John Borowski served admirably during both the robust times and trying times of the Performance Audit Committee. And I hope they're listening. If not, I hope you'll join me in passing along my thanks to them.
I'm sorry, I keep wanting to call you Shanna, but everyone else is much more appropriate. So Ms. Miller, is there any other final statements you would like to make to the board at this time, as we're sort of looking at context and future decisions on this topic?
I'll just say that, so in 2020, the audit committee did just a lot of work around and research around the recruitment and compensation, and that we have made our recommendations. I believe an email was sent to the board in October. I think I have that right. And so we feel like we've done the work, and now we're just ready whenever the board is ready to go over those recommendations and dig into them. So yeah, that's all I wanted to mention. Thank you very much.
No, thank you. And if I may, since knowing you for 2 years now, and you've not ever been on anyone's payroll, your passion and your persistence and your patience is appreciated and noted. So thank you very much for your time today.
Yes, thank you.
Okay, we are now going to move on to item 9B, Commissioner's Business Announcements. Do commissioners have any announcements at this time? Commissioner Bozovich.
Very quickly, got a notice from the Oregon Coastal Zone Management Association that they wanted us to identify our appointee, who was myself when we made our committee assignments, and an alternate for the Coastal Zone Management Association. So I was going to suggest that maybe we identify, and it doesn't have to be an elected official, it can be staff, that maybe we can identify either Alex Kyler as my alternative, or if there's another commissioner that wishes to be alternate to that organization. But I just wanted to make the board aware that that request has been made, and we need to kind of let Ms. Jones know who to identify on that form as my alternate.
Do you have a recommendation, Commissioner?
I would kind of recommend Mr. Kyler, because most of what OC's DMA does is react to legislative concepts and bills that relate to coastal management in one form or another. So he might be an appropriate person, since he's already tracking many of those same pieces of legislation.
If I may, does any commissioner object to that recommendation? Then I would suggest that we will inquire to see if Mr. Kyler wants to be either your alternate or your alternative.
Yeah, I haven't asked him.
And if not, we will bring this up again. But thank you very much. Any other announcements, Commissioner Bozovich? No? Any other commissioners? Seeing none, future board requests. Are there, Commissioner Buck?
As we've all been seeing, a lot of folks emailing in regarding a voters pamphlet. And we've had this discussion in past years. The crux of the issue seemed to always come down to, well, we're not getting the funding to do a voters pamphlet in these off-cycle years. And so I was hoping to suggest to the legislative committee if this is something that they could take up to figure out how we can, or what is the method to get additional funding, so that if it comes a year like this year where there'll be several things going on in elections and either levies or bonds, that we can figure out what the resource needs are and how we can go about accessing those resources to put voters pamphlets on in off-cycle years.
Noted. I thank you. Commissioner Farr, you and I are board reps on that body. I have no problem if you do bringing that up as an item. It might solve future issues. I don't see it solving this year's issue, but it's sure nice to get in front of these kinds of things. But thank you, Commissioner Buck. Commissioner Farr?
I concur. Thanks.
Do any other commissioners have future board assignment requests? Commissioner Trieger.
Thank you, Chair. I want to echo and thank Commissioner Buck for raising the issue of voter pamphlet. And I actually had email conversations with our county clerk, and there are more resource considerations than money. Obviously, money is one, but it's not the only one. And so I would really appreciate us having time to have a conversation about how to accommodate and create better equity in voter information for elections, so that our elections are more equitable. That is of great concern to me. I would like to float an idea. It has been so useful and necessary to have our regular weekly COVID updates. For a while, we were getting weekly fire updates, and now we've dropped the frequency of that as there's a little less movement. But I think this issue of what's happening with our unhoused population, as it relates to housing broadly, but very specifically, the humanitarian crisis of thousands of people sleeping rough each night in our community, and how many emails and calls all of us I know are getting on this issue. And there's just so much community awareness and concern. And I know you all passed a declaration declaring homelessness an emergency without any particular actions connected to it. But it's all coming together to me, and I'm wondering if we wouldn't benefit from having a regular standing agenda item, the frequency to be determined, where this is just something that we commit, we will spend time on each regular meeting to hear an update from our staff about progress being made, partnerships, similar things like what Commissioner Farr offered this morning about the deployment of pallet shelters, and so on. It just feels like such a ongoing and urgent crisis that it warrants us bumping it to that level where it's a regular update that we're receiving. So we're all getting the same information at once. We can encourage the public to tune in and listen to those conversations and stay on top of what's happening, and really to learn the efforts that are going on. It's such a big issue. And of course, when we're doing things to address it, that's the invisible work. And so bringing that to light so the community can see just how much is being done and how much resource is being committed, how many partnerships are in place, I think would be a real public service, and I think it would benefit all of us as commissioners to get all the same information at the same time on progress toward that issue. So that is my request.
So if I may, this is not a request for a work session or a board assignment, although it would probably have to go through that process, but it's going through that process to get something that Commissioner Trieger, just tell me if I have this right, that is of such importance that it end up being something that is scheduled on a regular basis as a report back to the board. Do I have that correct?
That's correct. And I wonder, and Mr. Mokrahewski might have something to add about this, how it also might not just help sort of structure and organize staff work around this so everybody knows there's going to be an opportunity to report rather than it being a sort of, a little more of an organic or a catch-as-catch-can issue to get on an agenda. If we just know we are dedicating that time because we're dedicated to addressing this and that's going to require consistent, concerted effort and agenda time, I think that I'm imagining that actually might be helpful to staff as well to be able to organize around a schedule like that.
Steve, I've heard Commissioner Trieger ask you what the logistics of that or logistical implications would be.
Yeah, happy to. And I think Commissioner Trieger and I spoke about this, I think, last week. And I think the idea is that it could be, as Commissioner Trieger indicated, similar to our COVID updates, probably not as frequent because there's, the interventions, the work is, of course, we're seeing with COVID. But it could be monthly or maybe even to start a quarterly update, I will say. So I think that's, if the board is supportive of that, I think that's certainly something that we can do. It will take some staff time to pull that together, but I also agree that it may help sort of organize and have this more definitive update for the board. It is a body of work. I mean, I think what we want to be careful of is that we're not having regular updates on every topic that we deal with, but this is certainly a body of work that just routinely comes to the board. There are issues that come up under your announcements that you're asking about and wanting information about. West 11th comes to mind as an issue, or pallet shelters. So I think creating some structure and organization certainly can make some sense. There was one other thought, sorry, that I had about that, and maybe I'll think more about it as.
This is the first time I ever saw you lose a thought. I have Commissioner Parr had his hand up.
Well, I can maybe spur that thought in your mind, Steve, Ms. Mokrahewski. We'd be challenged to find a time when poverty and/or home homeless was not an item that we talked about on the agenda, whether it be in an real instance that Peace Health is providing pallet shelters to St. Vincent de Paul. Well, we provided pallet shelters to St. Vincent de Paul. So regular reports may, in fact, help people to understand, not only us as county commissioners, but the public understand the direction that we're going. And if it's less catch as catch can and more in a formalized and outlined basis, then it would be a forum for us to get the information out.
He found his thought.
You can read my mind here now. The other thing I was going to say, and I agree with everything Commissioner Farr just suggested. Tomorrow you have a joint elected official meeting with the City of Eugene, City Council, and you're going to hear an update from Soraya Johnson and on behalf of our joint work with the City of Eugene around shelter and housing and the TAC report. Our plan is to do quarterly joint elected official meetings, and that's sort of, I think, a similar idea that we get this rhythm. So I think one thing we could explore is you may want to think about, would you want an update from our staff like before those joint elected or after? What would be better? to either kind of prep for or to debrief from. But I think that makes a lot of sense if the board is supportive of it. And I will just say, in the last year, we've not only have we done these weekly updates on COVID, we're doing daily messages, email messages that we're sending to employees and community members. I tried to get out of doing that several months ago, and I thought, oh, people aren't going to want to read these emails every single day. And it was like, no. Everyone's like, we need that information. We're relying on that information as an accurate source. So I think for the work that we know isn't going away anytime soon, that we routinely hear about and the community is concerned about and our staff is actively working on, I don't think we can ever go wrong by over communicating and over updating and over sharing information. So thinking about the kind of sequencing of it and the timing and all of that and making sure it isn't too much of a burden on staff or your meetings, we can work on all of those things.
So I would, I've got 2 points. The first point, unless other people want to speak to this, is to ask for a head nod via a show of hands as to how many people would want to have a work session to determine the best way and the logistics to keep this front of mind for the Board of Commissioners. Can commissioners, yeah, go ahead, please.
Chair, I was just going to say that, I think staff can figure that out along with the agenda team. I don't know that we need a special work session to work that particular detail out.
Hey, if you made that point and Commissioner Bozovich put his thumbs up, I'm good. If Commissioner Trieger is good.
I am, and I agree. I would love to hear from staff. They're thinking, quarterly feels a little far, and monthly maybe a little too frequent, but I'm open to hearing back from staff. They know best. But I do, again, I just want to emphasize, because Mr. Mokrzycki said, business that's not going away anytime soon. The vast majority of what we do isn't going away anytime soon. I'm really just trying to elevate this and demonstrate to community our understanding of this as truly an emergency and a crisis issue rather than the ongoing business of the county. Thank you.
Thank you. And the second, so we're good there? The second thing I was going to say was whether we're talking about people that are addicted to opiates or other addictions, whether we're talking about various kinds of businesses and the criteria for providing whatever the top, there are so many topics we deal with. And reminding everyone that when Commissioner Buck was chair, one of her priorities was creating a housing action plan, which did occur last year. A lot of work has gone on. So this is not being proposed in a vacuum, and we'll hear from you, Steve, on this one. May I move on? Is that okay? Are there any other assignments or board assignment requests? Seeing and hearing none, we're on item 10, review of assignments. Mr. Mokrzycki.
So I had the 2 Commissioner Buck's requests that I saw support from the majority for to refer the matter of the voter pamphlet discussion to the legislative committee, just around funding and also I think to hear, as Commissioner Trieger indicated, there are some issues outside of just the actual production costs, but some other logistical things. So I think hearing from the county clerk on that, and then really thinking about what can we do to be a little more intentional about that work. The second is, so that would be a referral to the legislative committee to discuss that. And then the second one is to refer to the agenda team to discuss scheduling a standing agenda item on the Progress Partnership and solutions around shelter and housing work that we're doing. So I think the idea was, let's take that to the agenda team and we can discuss along with, Sarai Johnson and Karen Gaffney and Steve Manila and the folks who are doing a lot of this work, how we could go about providing those updates and what the frequency should be. So those are the 2 that I have.
Thank you.
For Diana, I'd just say, sorry, I'll just do this for Diana. I think we'll probably have Alex Kyler take the voter pamphlet. He'll be the lead one on that because legislative committee. And that, as well as Cheryl Betchart, the chair will be a support on that one. And then on the housing and shelter update, I think we'll give that kind of we'll probably give that to Sarai Johnson to coordinate along with Steve Manella and Karen and other staff.
If I may, and you're going to check and see if Alex Kyler is willing to be Commissioner Bozovich's alternate on that one group.
Yes, I'm not sure if that's an assignment or a task, but we'll get that one done too.
Hey, as long as you get it done. Thank you. We have no additional executive session. Item 12, other business. Seeing no commission with other business, I'm reminding us that we will meet again tomorrow at noon in a joint elected official meeting with the city of Eugene. And until then, have a great day. This meeting is adjourned. Thank you.